everybody, this is Rusty Jenkins from Wasatch Physical Therapy in Layton, Utah. Today I wanted to walk you through what a shockwave session might actually sound or look like, and to determine whether or not it's something that you would like to consider in helping you get along to living your best life and getting you back to life. So with the shockwave that we have, it's a soft wave device, and soft wave is the only broad focus device on the market, which means that it treats a much larger area instead of a small focused area. So the area that a broad focused device will treat is pretty much the depth and width of a soup can. So if you take half of this cylinder, that's the width and the depth of all the tissue that it's going to treat with your session. So if you take that and you go to a focus-based solution or device, which one would you prefer to treat? You want to treat this much tissue, or do you want to treat this much tissue? And so that's what this broad focus device will do, is it gives you much more bang for your buck, and it treats a lot more tissue area instead of just a small point. So this device actually has what's called a plasma driven shockwave. So when I initiate the shock, you can see that spark or that light up, and that's a plasma driven spark that creates the shockwave inside this water filled dome. And that shockwave, as it's attached or in contact with your body, then that shockwave goes in through your body and it ripples the cells, which creates this force that causes the cascade of events to occur. And we know that your body can heal, but sometimes the healing process doesn't happen. And so this can help that healing process to be initiated again, to heal those tissues that just can't figure it out on their own. So as I initiate that shockwave, you can hear that click, and that's just the plasma spark that's causing the shockwave to be initiated. So as we put that in contact with your body in healthy tissue, you actually don't feel anything. You might feel a little tapping, but you don't feel any irritation, any pain, anything like that. So in a previous video, I talked about that this can be diagnostic, and it really is true. So if I'm treating tissue and I'm getting no response at the appropriate energy levels, then I know that that tissue isn't the problem tissue. And so I'm going to search around and I'm going to find that spot that responds to that shockwave. And so as I'm going through different areas, we're really looking for tissue to kind of be aware of the shockwave. So we call that a moderate discomfort or a spicy ache. So a deep muscle ache with a little bit of feeling like there's a rubber band flicking you a little bit. It's not severe, it's not an intense older brother flick with a rubber band. It really is just a slight kind of tap or a flick of a rubber band with a deeper muscle ache. And through the treatment, we want it to only be moderate. We don't want it to be severe. We don't want it to be really painful. The reason why is because in a previous video, again, we talked about we want the right amount of energy to go into the body. We don't want cellular damage. We want cellular healing and reconstruction to occur. And so that moderate discomfort is where we want. The nice thing about the treatment is as we're treating an area, if it's about a 5 or a 6 on the pain scale, then with the proper treatment, then it should decrease to a 1 or a 2 or no pain at all. And that way we know that we've treated that tissue out appropriately during that session. And so during the session, that's what we're looking for, is we want that pain or that discomfort during the treatment to go away. And we know that we've treated that properly and that we can move on. So the treatment sessions are usually around 10 minutes. That's really it. It doesn't take a long time to perform this treatment. Treatments can be between 1,000 or 1,500 shocks. That's usually what protocols show are the optimal levels or number of shocks to create a positive response in a one session experience. And so that's really what it looks like. It takes about 10 minutes. After that, we go into another type of treatment, whether it's more physical therapy or home exercise program or whatever. So if you have any questions about any of that, if you're interested in learning more about Shockwave, you can contact me at my clinic at 801-784-7373. Thanks a lot.